And you have to click you accept. Great.
Okay.
So Suzanna, welcome to our conference. If I may, I just want to introduce you as a woman who's a transgendered woman. You've gone through transition and you've been seeing a urologist out of concern around an elevated PSA. We're going to spend the next 20 or 30 minutes talking about your experience, both presenting to a urologist, your own concerns on a personal level, to the extent you feel comfortable, and things, helpful hints you could share to other transgender women in our audience.
Yeah.
So welcome to our conference. Where are you located and what kind of work do you do?
I'm based in London, in South London, and I've now retired. I'm almost approaching the grand old age of 75. So,
oh, wow.
So,
no one in our audience is believing that, but go on.
Anyway, since I worked as a management consultant for some time, but I transitioned about 12 years ago now, and since then I've been sort of doing various things pro bono and some fee-paying stuff, but broadly in the medical area. And so I suppose you would call me a bit of a activist stroke busybody on the sort of LGBTQ trans sort of in the trans environment. So I kind of get him, and I also, having, you know, I don't want to be too specific on that, because I think it's rather important that, you know, people in our position as trans people should actually engage at the level as being, you know, active, engaged citizens across the spectrum. You know, not necessarily being boxed up as trans. So I mean, I'm involved in a range of activities. Some of which have, you know, a number of which have health things, but they're not. I don't necessarily work under the label of being a trans woman, as it were, right? You know, I like to generalize it. You know, it's all that is that I believe it's a Marcusean expression. It's all about the long march through the institutions and normalizing the sort of position of people like me, really.
Yeah, and to a large extent, a broad extent, barriers to healthcare and access to healthcare and appropriate healthcare exist for all minority populations. What's interesting, I think, just sort of obviously to our audience, is that transgender women with prostate cancer are as minority a population as one might imagine. We might even characterize it as a rare disease population based on just the census. But it's critical to understand that prostate cancer exists for men and women, and people ought to know how to treat men and women around prostate cancer. What I've heard from trans community is that, you know, outside of the trans community, we talk about we want to get the best care possible. But within the trans care community, that gets transformed into saying we want to get any care that's possible, that it's hard to even imagine, you know, optimizing care. What was your experience around getting, you know, for as a person age 60 and up, let's say, for the last 15 years, you know, which would encompass the period of your transition? Does quality care come into play as far as agony, frustration, or any negative attribute to that?
No, I mean, I've being a sort of professional middle-class person, as it were, one tends to have a very clear sense of what of one's entitlements and what's necessary, and you know how to navigate the system. And so, from my point of view, and I don't want to generalize from the particular, but there are lessons from the particular. is that it's been a process where I've been able to go through the system and get the care I want, by virtue of being very clear about the issues and knowing where to go. And I think and also knowing that this is an important issue, because I didn't want to end up with undiagnosed prostate cancer, frankly. So it was an imperative to make sure that I was not going to be lumbered with undiagnosed prostate cancer, with all the things that can, because, as you know, it's a major killer of men. By virtue of having a prostate as a woman with a trans history, I am at risk potentially, and I needed to make sure that that risk was minimised. And and the lesson that I draw from that is that not enough trans women are sufficiently aware of the potential risk that they're running, and the need to think about that carefully, and to do something about it if they taking PSA tests and so on, or are having symptoms, because I had symptoms. But and so there's a process there of knowing that there is a potential issue, but then it's about how do you navigate the system to get the care you want. And it's at that point that the problems arise, because you have these extraordinary situations where say somebody has actually gone, a trans woman has gone over the first step and managed to kind of pluck up the courage to talk to her general practitioner, a medical advisor, her clinician, and get a reference to a urologist, and so on. So they march up to the desk, the reception desk, and in the urology sort of prostate clinic, and somebody, the person on the desk looks at them and says, "Well, you're a woman, you shouldn't be here." And you can imagine what that feels like, particularly if it happens in a room full of men, and you're the only chick in the book on the island, as it were, in that context. And so having the courage, having identified that you may need to do something, then having the courage and the ability to go through the process with and get what you want out of it without being put off, is really very important. And I think there's a key lesson there, which I think puts a lot of trans women being diffident. And it's about this, I think, what you referred earlier, about actually feeling that they have the right, and in the context of what's here in Britain, it's a right. Because I was up to the age of 65, I was a professional middle-class man with rights. Those rights didn't change because after 65 I transitioned. I still had those rights, and that's what people have to internalize. You have rights under the law, under the Constitution here, for what it's worth, you need to be able to feel confident about exercising those rights, and so on. And I think that's really, really important for trans women in this area, particularly.
Yeah, and it
Does
does
that make
make
sense?
yes, indeed. It makes very good sense in the sense that it also highlights those who feel less empowered and have
That's right.
less physical and status and sense of entitlement. People of color, people of low income, even rural people, and immigrants, et cetera, et cetera, et cetera. And the courage to have gone through transition is remarkable for minority of minority populations, you know. But then when you need to take care of a disease, particularly one that threatens your life, I mean, my goodness, what do you imagine life would be like for that? What do you imagine a black woman, a transgender woman, walking into your urologic office or setting might experience, if
Mm.
they even get to themselves to the
Even if
door.
they get to that point. I mean, I have to admit, I've not been able to not observed that. But you know, my own experience, I mean, is living, because I live in a very mixed area, and the hospital that I go to has a very mixed intake and so on, and going going into the prostate cancer clinic when I went for a review, the room was absolutely chock-a-block packed with older, many people of color, actually, males. I didn't see a single woman in the room. You know, what a surprise. And you know, it does raise the question, because you know, there are trans women of color, obviously, and in the community, but they tend to keep quite a low profile, actually, for a number of reasons, which I'm sure you're aware of. And so it is, I think it's a worrying thing about how far those people are going to get access, proper access to care, without sort of suffering the consequences of not getting that access. And I have to say, as I think I'm implying, this is a not a very clearly understood area here. I mean, it's not the issue hasn't got profile, not got profile. Essentially, the people who articulate, in my experience, from the trans woman's perspective on prostate issue, are older, white, middle-class women. You know, the kind of usual suspects, if you like, you know, who've been doing this in the past and do it now. So it's the ability, you know, there is a kind of lacuna here, which we need to address, in my view, and I suspect that will be the case in the States, from what you're saying.
Sure. And just for those who struggle to understand what a lacuna refers to, could you just give us a quickie on that one?
it's an unoccupied space, is the way I'm using it. You know, that it's kind of a vague area where it's not where there's this you know, where there's a void, if you like. Let me put it that way. You know, nothing. This it's a space that needs to be, you know, acted on, if you like.
Yeah. Yeah. So let's get a bit nitty gritty and helpful hinty for people viewing this. For trans women, what should women who have transitioned look for in terms of concern around prostate cancer? I mean, elevated PSA, obviously, but what are the symptoms that you experienced? What do you imagine uh, symptoms that may, in fact, be unique for transgender women?
Well, I think in its essence, they're the same as for men, and it's basically issues about urinating, pain when you're urinating, blood in urine, and so on. I mean, I don't think you can, for one moment, rely on the PSA tests, because we know they're problematic if you manage to get them. You know, there's numerous cases, aren't there, where people have had a PSA test and nothing has shown up, and you know, surprise, surprise, it's a false negative, or the other side is it's a false positive. I think what is key to it is you have to listen to your body. You know, take note of what's going on, because that was certainly the case with me. You know, I was beginning to feel uncomfortable urinating. I couldn't, you know, and there were and it was about control, because one's bladder goes absolutely mad, doesn't it? Trying to sort of pass urine, and then so you're always wanting to run to the lavatory and so on, and then you know, then there's the issue of when you actually get there, can you perform? So you don't have, you know, a rather you know, you don't have the conventional and the experience sort of satisfactory stream. So I think those are the kind of symptoms you've got to be very aware of and to take note of. And that's what, in my case, drove me to my doctor to kind of investigate what was going on here, because it was uncomfortable and embarrassing, and I needed to do something about it. And fortunately, I was able to do that pretty quickly with a group of with a service with a urology consultant who actually is pretty good. Well, is very, very good, actually.
So listening to your body is absolutely spot on, a good construct, good way to think of things.
Yeah.
But as a transgender woman, most transgender women, as I imagine, as I've read about, but I don't know, don't recognize that they have a prostate. Indeed, I mean, they may intellectually know, but they just sort of, it's not, a thought in the world. So even around a urologic problem like difficulty urinating or blood in the urine, etc., is it commonplace that a transgender woman would understand that's a urologic issue as opposed to perhaps a gynecological issue?
Well, difficult. How do I come at that? I mean, obviously, there is this question about how aware you are of your body and the way it works. And, if you've undergone, and we're talking about different categories here, first of all, some people who transition don't actually have lower surgery. And that's the case here in the UK, because they can't get it because it's expensive to have. And although if you go privately, or the waiting list in the NHS where you can get it is a long one. So there's a problem about getting access, about having lower surgery, and knowing that you've got essentially, you've had a vagina, you've got a vagina, and so on. But the technology of that is not necessarily, or the biology of that is not necessarily understood. The fact that you actually, in the process, you don't lose your prostate. You still retain that. That's still part of your male anatomy, even though you've had, let's say, you've had full vaginoplasty. You would have lost your testes and your penis and so on. So you have to know essentially what you're likely to be left with, and the way in which your body potentially may experience issues and problems, and so, and it follows, doesn't it, that I mean, a lot of men are not properly aware of their prostate and what it causes, and they'll be in denial about seeking attention and dealing with the issues. And I think there's a read across to that to trans women, because they don't necessarily know, and they've not necessarily thought about it. And that's one of the reasons, that you're having this event of yours, and we're talking about transvision, because we really do have to raise raise awareness of this thing. I mean, the cohort, and this is where I start to get a bit preachy, the cohort of trans women who are likely to be running into issues with their prostate, whether or not they've had surgery, is growing all the time, because we are getting more and more people coming out as trans women and wanting to transition. So it's really important that they are aware of what could befall them. And it then follows that, on the other side, clinicians and providers understand too that, trans women are going to be in this position. So they don't repeat what I said earlier about, rocking up to the reception desk and being told, what are you doing here? So it's a growing, to my mind, this is quite a serious problem, because if it's not treated and the cohort gets bigger, then we've got a lot of people at risk. And I think that's my principal concern, that the level of a growing cohort of risk, which needs to be understood. And there is a kind of one of the things that is interesting about this, which I'm reading, because I'm in the process of preparing advising on preparing a guidance note for trans women with something with an organisation called the Royal College for Obstetricians and Gynecologists, which is one of the prestigious royal colleges in this country. There's a view that comes across, which we've had to address, is that just because you're having hormones, it doesn't mean to say that you're taking estrogen, that your risk of prostate cancer, prostatitis, is reduced, because frankly there is a potential, there is still a risk, even though the incidence may be smaller. I mean, and that's at the moment, I think the jury's out on that. People are thinking, well, because I'm taking estrogen, that's going to actually protect me against prostate cancer. Well, dream on, because we don't know that. It may be the case, it may lower the risk, but you still got a risk. And let's not be complacent about that. Sorry, I've gone on a bit about that, really.
No, but that's lovely, because in fact, one of our speakers until very recently was absolutely certain that hormone therapy for transgender women and for the transition and maintenance is protective against prostate cancer, and that's why we see so few presenting. And in fact, we, just like with any structural barrier, I mean, it's Malecare's, proposition. We're convinced that it's not that there are so few transgender women with prostate cancer, age 50 or 60 on up. It's that it's difficult to present,
Absolutely.
and let alone find doctors capable of treatment and such. Yeah. I mean, you've had good experiences with your doctors, but many people don't. For those who don't, what do you imagine might be good suggestions or useful hints for them?
Well, I mean, the starting point is to be very clear about your rights and the obligations to be treated. There's no such thing as denial of care. You start off by listening to your body and you say, right, I've got a problem, and you should be clear in expressing that, and being able to articulate it. It's about personal advocacy, and then having that conversation with your personal clinician to say, look, I'm really worried about this. What can we do? In this case, in Britain, you have this primary care. Your first port of call, if you're not with the National Health Service, is to go to your general practitioner, and you have the discussion there, and then they refer you to what's called secondary care, which is a consultant in a hospital for a professional consultation. And you've got to make the case to get yourself onto that care pathway, and you mustn't be denied from that. You must actually advocate very strongly for yourself. Now, complementary to that is to understand where the best place to go is. That's a matter of asking colleagues, friends, the networks, the various sort of support networks that we all have in the LGBT community. You talk to friends. Look, I've got this issue. Who do you recommend I go to? Because some people are switched on and others aren't. So a woman I know who lives in Nottingham in north of England was having a prostate problem, and she kind of was really, frankly, not getting the response she wanted, to the extent that there was a kind of, one of the nurse practitioners in there in the service said, trans women don't get prostate cancer. What? So you've got to find the right place to go, and you have to navigate the system, and that's absolutely critical. And if you can find a particularly sympathetic clinician service, which in my case I've been very, successful in doing. I mean, it's almost serendipitous, really, in this context, that down the road from where I live, there happens to be an extraordinarily capable and competent urology service headed by a very competent urologist who's very kind of trans-friendly and switched on, and we've worked together subsequently, and it's following that through, and then also looking at the sources. I mean, you mentioned earlier, I think, when we were talking about Prostate Cancer UK, they've produced some detailed work now, including case studies and advice for trans women on prostate cancer and prostatitis. So, you can refer, if somebody asks me for advice, I say, well, look, go onto the prostate cancer site and look at it. Look at the case studies on there, of which incidentally I'm one, and sort of, get some ideas about what the situation's like, because what you need to do and what you need to ask. So it's kind of constructing for yourself a sort of plan as to how you're going to go about this. You arm yourself with the information. You're very clear about your personal circumstances and your symptoms, and you know where you want to, and you've identified the ideal place to go. And then if you go to a place like the urology clinic and you get the experience that I've just described about a nurse there saying, well, trans women are getting it, you think, well, hold on a second, either I escalate this to a senior clinician in the place, or I go somewhere else, because you can do that. So it's a kind of, you don't necessarily want to do that, but I mean, that's what you've got to do. I mean, it's in your hands. You have to do that, because nobody's gonna, it's not necessarily going to be done for you. It's the active self-advocating patient that I think is really important in this case, really.
Yeah, and these are lessons not just for transgender women, but for cisgendered cis.
Absolutely.
Yeah,
Cis men, yeah, absolutely.
I mean, I've been starting the habit. I wish I started it years ago, of asking gay men, transgender women, versatile men, what lessons can straight men learn from you? You know, and it's this activism, this courage, this tenacity, and overall, all of that is a sense of self-worth. I am worth being taken care of.
Absolutely right. Spot on.
Yeah.
Spot on.
Mailcare's new booklet for transgender women. I don't know what the pithy title is, but it's something, a guide for transgender women, where prostate cancer will be linked below. And to the extent I could find links on Prostate Cancer UK, I'll stick those down below as well. But any last thoughts, Suzanna, on and any last guidance for our audience?
No, I think I've sort of ranted on quite a lot, really. I know, I just, I hope, what I've said has at least a modicum of coherence in it. And, people get something out of it, because, the strong message is, there is an issue here for trans women, and, they have to kind of press, this is as important, I think, in terms of long-term health, once for sustaining health, as for example, seeking hormone treatment and surgeries and affirming surgeries and so on. I mean, this is important. It's about the way you're going to be able to live a healthy life, and don't let it go.
Yeah, and healthy life equates with happy life.
Absolutely, absolutely, yeah. And a comfortable one, so you don't have to wake up 10 times in the night to go and have a pee.
That's important for everyone. Yeah. All right, Suzanna, thank you very much for your presentation, and thank you for being part of our conference. Good to see you.
Okay, my pleasure. My pleasure.